Hey, it's Dr. Schmidt. Here's my update for the day. First one is, Dr. Kahn, he's the vegan cardiologist. He's kind of all over his social media. His office is not too far from my office. And several years ago, I referred a patient to him for a surgery. And the guy needed a new valve. And Dr. Kahn did a great job. And I really appreciate that. But I wouldn't send people to see Dr. Kahn for nutrition advice. Okay, my next thought is don't be fooled into thinking that your organic food is healthy. And it's a nice thing to go from commercial food, whether it's vegetables, meat, muffins, pizza, candy. Organic's always better, but you can't ignore the macronutrients. So organic muffins still should not be purchased or consumed. Okay, and having said that, you can Google IIFYM if it fits your macros. So it's kind of a diet. It's a way to, position your food if it fits your macros. And that's kind of like what I've been talking about for a number of years here is fats, proteins, and carbs. Okay, I got to talk a little bit about mold and air pollution, specifically mold. It will affect your voice. It'll make your voice shaky, weak, coughing, burping. So when I was in the moldy office, I was doing videos just like now, but I had to stop the video and edit out the coughing. And some of the coughing escaped, and it's still on some of the videos. But breathing in those spores, it affects your throat, it tickles your throat, it irritates it, whatever you want to call it, and it'll make you cough. Also too, the burping, swallowing air, breathing in air, it goes down into here. And I'm telling you, it seems like some of my afternoons, I felt like I was burping all afternoon. And I'd come home and it would ease down because I was at home. Go back in the morning, I'd be okay, but by the afternoon, I was just burping all the time. Now you can have burping. Oftentimes burping comes from mold, yeast, candida, whatever you want to call it, in your intestines, in your stomach. And don't forget, you can get mold not just from a moldy house or office building, but from eating sugar and from taking steroids and from taking antibiotics. A lot of side effects of medication use include destruction of your microbiome, weakening of your immune system, overgrowth of yeast, candida in your intestines. Okay, I want to say this statement. You can just have a healthy body and have healthy lab tests, right? You improve the health of your body and you end up like the lab report is like a report card. Here's your report card. You've been doing a great job, good lifestyle choices, good diet for 6 months or a year, and now you have an A+. Instead of looking at your labs and saying, okay, here's a number that's off, let's bring it down. Or here's a number that's too low, let's bring it up. And you end up on a bunch of medications, or you're treating, like LDL with garlic pills. Like just work on having a healthy body, and then the lab test normalize. That's what you want to treat as a body, not the numbers on a piece of paper. Okay, I have one of my practitioners is bringing me 3 new success stories regarding cancer, and I should have those next week. And we're getting HIPAA release forms from the patients. And I won't say their names, but I just want to cover my butt at the federal level, federal government level, so that HIPAA is not being broken, the Privacy Act. But I was telling Nina Teicholz back in August when I met her at a conference about like what I was doing in the office and ketosis, etc. And I told her I had 7 patients reverse their cancer. And she goes, look at you, a chiropractor on the cutting edge of cancer research. And I was like, yeah, it's food. And the supplements are basically unnecessary. They're helpful, but it's the ketogenic diet, it's ketosis. I want to share a story. I had a book from Walter Willett. He is the vegan, vegetarian proponent, medical doctor at Harvard School of Public Health, and he's been there for decades. And I moved to Ann Arbor from Ohio in 2000, and at the time, the University of Michigan Hospital had monthly lectures on alternative medicine, and I went to these. And Walter Willett came to speak once, and I was really excited to see him, but I couldn't because of my schedule. So instead, I bought his book. And I remember opening up his book, and I was very disappointed because he was a vegetarian, vegan proponent. So I put the book away, and I stored it in my office for 13 years, that moldy office. And after I moved, I threw a lot of books away because of the dust, the mold, the spores. And that one book, I was going to do a video about his book, his information. And so I took it home, and I was preparing to writing down what I was going to say. I took it home, and I opened up the book, and I started coughing, and I felt the chest pain. So I closed the book, threw it in the garbage. And that's not the kind of book you want to recycle to the local library. And you can't recycle hardcover books, at least not at the time. So I just ended up throwing it away. So my story here is twofold. Number one, I was going to do a story bashing Walter Willett because he deserves that. Because he thinks that observational studies are worthwhile to form clinical opinions and direction. They're not. Only clinical trials are, or randomized controlled trials. Number two, you can have an item in a moldy place gathering dust, and you have to throw it away or clean it. Those are your two options. And so I've talked to people on Skype or on the phone, long distance, and they're moving out of their apartment or their house, and I ask them, what are you going to take with you? And they, will leave the furniture. They're going to throw the furniture away. They're going to take some clothes. You got to wash your clothes correctly. You can Google online how to wash mold, black mold out of your clothing with your washing machine. So just keep that in mind if you're in that situation. Okay, the last thing that I want to talk about is I had mentioned yesterday that I don't evaluate emotions, and I don't give my opinion on, especially when we're trying to just work with the body and improve the body. And I'm saying this because it's a relief for people, patients, you. It's nice to talk just about let's fix the body. There's people that are super angry, and they're angry because their body's sick. And so, you go to a psychologist or whatever, and they're gonna fix your anger. Well, how about fix the body? How about feel good here and here because the biochemistry is correct? And then the emotions are calmed down, if you will. And then you get that wellness feeling, the ability to maintain your space, maintain your composure, and not get frazzled. Your brain's working. You can think straight because you've been feeding your brain. That's why I said that. After I did that video last night, I was thinking, well, I should give a little bit more about that. But there's such a huge focus on the emotions throughout the United States. 25% of Americans are on psychiatric medications because of emotions. Well, you fix the body, fix the biochemistry. Nobody should be on any psych meds except for maybe 1% who are truly mentally ill and they belong in a mental hospital and they're born that way or they had a severe trauma. Most people don't need psych meds. They should have had a proper nutritional evaluation from the beginning. Okay, those are my thoughts. I wrote these down and there, now you have them. All right, so if you want to be a patient, the best way to do that is call the office. All right, see you next time.